Morning, everyone. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Also-Brooks. We'd like to thank you all so much for coming. We are prepared this morning to make some announcements in terms of our COVID updates, but also the county's path forward as we watch our numbers decline. So first we'll hear from County Executive Also-Brooks, followed by Deputy Chief Administrative Officer for Health, Human Services, and Education, Dr. George Askew.
Good morning, everyone. Today, first of all, thank you all for being here. Today, I want to provide an update on our COVID-19 numbers and want to share also the latest regarding our vaccination efforts and how we're moving forward cautiously to reopen businesses, to further open up businesses in the county. I know that we are all eager. We are so eager to get back to a feeling of normal, and I assure you that we will get there. However, just as we've done since last March, we will continue to be cautious and rely on the science and data to guide our decisions. Since last March, 74,726 Prince Georgians have had confirmed cases of COVID-19. 7,577 of our residents have been hospitalized, and 1,321 of the members of our community have passed away from COVID-19. This pandemic, needless to say, has taken a lot out of all of us, and we are continuing to do all that we can to reduce the impact of this pandemic. We continue to pray for every family who have lost loved ones, those who continue to suffer. We're going to get through this together. I'm happy to be able to say that the future of Prince George's County is beginning to look much brighter. Our number of COVID-19 cases continues to trend down since January, and our infection rate continues also to slow. So in addition, our 7-day average positivity rate as of March 6th is 4.3%, down from 7% just 1 month ago. Our Deputy Chief Administrative Officer for Health and Human Services, Dr. Askew, is with us this morning. I want to thank him for the tremendous work that he and his team have done. I want to thank everyone at the Health Department. They have worked literally around the clock, and I do want to thank them as well as all of our employees for the absolutely beautiful job that they are doing. He will in a moment provide an in-depth update on our current COVID-19 numbers in a few minutes. But the metrics clearly show that we are in a better place than where we were just a month ago. Prince Georgians have done an excellent job, and I want to just thank all of them. Prince Georgians are just amazing. They have sacrificed greatly. They have listened to our guidance, and because of that, they're doing such a great job in reducing the transmission of COVID-19. So I want to thank you for continuing to practice social distancing, for continuing to wear your masks and looking out for each other. The county continues to make significant progress with our vaccination effort as well, and we will do all that we can to correct any issues that arise during this unprecedented process. Our health department vaccination capacity is now more than 2,000 vaccines per day, and our capacity has now increased to 15,000 per week. The health department is currently operating 5 vaccination clinics across the county, and we also have 3 mobile vaccination units that can administer 150 vaccines per day total. I want to just extend a debt of gratitude and thank you to Pastors Granger and Joanne Browning of Ebenezer AME Church, as well as Pastor Tony Lee and the Community of Hope AME Church for recently partnering with us to host mobile vaccination pop-ups this past weekend. Look out for those vaccination mobile units. They will continue to press their way through our county, and I want to thank our Office of Community Relations and all who have been involved, emergency management, with the mobile vaccination efforts. They've gone to the homes, literally, and to the bedside of many of our seniors who have been homebound and bedridden, and administered those vaccines. And I'm told that they not only do so, but do so with tremendous compassion and care. And so we're proud to be able to not wait just for those to come to us, but we're taking the vaccine out to those who need it. So I want to remind our residents that we will temporarily close our sports and learning vaccination clinic for scheduled maintenance. I mentioned this in our last press conference, but it's important for us to get that message out, that pre-scheduled maintenance will be occurring at the Sports and Learning Center from March 13th through March 28th, and we're not scheduling appointments because of this at this site during the closure. To make sure, however, that we do not lose vaccination capacity for our health department, we are opening 2 new sites, and Dr. Askew will talk about those sites in just a moment. And although we have the capacity to deliver approximately 15,000 vaccines per week, right now our vaccine supply continues to be our biggest limiting factor in being able to quickly vaccinate Prince Georgians. That is changing by the moment, however, and we're really hopeful. The good news is that even with these limitations, every day we're increasing the number of vaccinated residents. Just this week, for example, we reached an incredible milestone. Over 100,000 residents have received at least their first dose of vaccine, and just under 50,000 are fully vaccinated. And last week, we set a record by delivering 11,425 vaccinations just through our health department, an increase of 44% from the previous week. And again, I would be remiss if I didn't stop right here and say thank you so much for the tremendous work that our health department teams and all of our partners have done to help us continue to try to meet the need by ramping up and building that infrastructure to increase by 44% the amount of vaccine from one week over the next. Over 8,200 of those were first or single doses. And when we add in all of our partners distributing vaccines, over 31,000 vaccinations were provided to residents last week, which is also a record weekly total. As I've said before, we're doing all we can to further expand access so more Prince Georgians can join the growing numbers of those residents that have already been proud to be protected from COVID-19. In fact, members of my team met with Governor Hogan's team this week to discuss expanding priority vaccinations for Prince Georgians. And as you may have already heard, beginning next week, the state will, per our request, set aside at least 300 appointments per day at Six Flags for residents on our county health department's pre-registration list. And that's a total of 2,100 priority appointments per week. And this was in line with the request that we made, that we wanted to have at least a day set aside for Prince Georgians. This is pretty much consistent with that because they provide about 2,000 of those vaccines per day at that site. And so they have guaranteed from our pre-registration list alone a total of 2,100 priority appointments per week. In addition, the state will begin directly facilitating nearly 10,000 priority appointments per week for county residents over the coming weeks through an upcoming vaccination clinic at the First Baptist Church of Glenarden and partnerships with several local pharmacies. The clinic at the First Baptist Church of Glenarden should open next Monday and will ramp up to 980 shots per day by the end of the month for a total of 6,860 shots per week. Walmart is also conducting a 500-dose closed clinic for county residents each week at the location in Clinton, and 200-dose clinics at its Landover location. Wegmans has begun a 200-dose closed clinic at its Lanham store. This amounts to at least 900 shots per week for county residents through pharmacy partnerships. And Giant is utilizing 2,200 doses for closed clinics to vaccinate disabled populations in our county as well. And so we're pleased that the governor's office heard our concerns because with these partnerships and increased access to vaccines, we help to ensure that vaccines are distributed more equitably to the hardest hit jurisdiction in the state. And I want to thank his administration for working with us so closely to increase access to our residents, and we look forward to continued collaboration building capacity in our county as the supply increases. We'd like to also thank Congressman Steny Hoyer, who has helped to secure vaccines for one of our federally qualified health centers. We just got this news in today, so this is also more good news. We're excited that the Greater Baden Federally Qualified Health Center will be among the next federal health centers to receive an allocation of vaccines directly from the federal government. So this is yet another line of supply that is coming to us from the federal government to help us vaccinate our residents. And I want to thank each one of you who have signed up to be vaccinated for taking the opportunity to get this life-saving vaccine. I want to encourage those of you who have not registered to please do so and go ahead and get signed up. It's important that all Prince Georgians pre-register with the county, because this is how you will gain access to the closed appointments that the state is coordinating with us. For example, this past weekend, we provided the state with 30,000 names from our pre-registration list so that they can begin to book Prince Georgians into appointments at various locations. And we also provided 2,000 names directly to the Clinton Walmart. So we encourage everyone to first pre-register, and for those who don't have access to internet, call 311 and press pound. We also have a call center that's coming online soon to handle those who do not have access to the internet or do not have access to phones and do not have access to a cell phone. The information on how to pre-register with our county health department and a link to the state website where you can find other vaccination locations are all available on our county's vaccine website, and you can access that page at mypgc.us/COVID vaccine. Again, mypgc.us/COVID vaccine. When we take the vaccine, it not only protects us, but it also protects our friends and family members, neighbors, and those with whom we worship. And the faster we can get Prince Georgians vaccinated, the faster we can return to some sense of normalcy. And as I've noted earlier, our COVID-19 infection rates are trending in the right direction, and our positivity rates continue to be encouraging. So we continue to expand access to the life-saving vaccine, and more Prince Georgians, thank goodness, are getting protected every day. And with this in mind, I believe that we can begin to take a measured approach to lifting some of the restrictions on our county businesses. My first and most important responsibility will always be to protect the residents of Prince George's County, their lives, and their livelihood. And as we've done since the beginning of this pandemic, we are listening to the science and to the advice of our health experts. And so we've not forgotten that Prince George's County was the hardest hit jurisdiction in the state, and the terrible toll this virus has had on our community. We saw over the holidays how the trends can reverse and how infections can begin to rise again. But due to the decline in cases and our progress in delivering vaccines, our public health experts have advised me that we are now in position to move forward cautiously. That's why today I am announcing that we will take a measured approach to reopening, modifying current restrictions on businesses and other establishments. Starting on Friday, March 12th at 5 p.m., we will increase the capacity limit for all businesses and other establishments to 50% of maximum capacity. This includes, but is not limited to, movie theaters, gyms, indoor dining at restaurants, banquet halls, receptions, and meeting rooms, and houses of worship. In addition, indoor private gatherings, not otherwise specified, are limited to a maximum of 20 people. Outdoor gatherings are limited to a maximum of 50 people. I want to remind everyone that at these businesses and establishments, it is still required that you will wear a mask, practice social distancing, and other safety protocols and guidelines we have put in place to keep our residents safe and our employees safe. In addition, masks are still required on public transportation and outside anytime you leave your home. A complete list of our updated guidelines, in addition to a copy of the newest executive order, will be available online at mypgc.us/reopen. I want to stress again that these decisions were made based on the science and advice of our public health officials, and due to the progress that we have all made together in fighting COVID-19 and our current progress in vaccination efforts. Because COVID-19 affected us so deeply, our reopening will move at a different pace than the rest of the state. And while we are not ready to open as far as the rest of the state at this point, we are pleased by the information the health department is seeing, and our metrics tell us that we can safely do more than we are currently doing. We will not throw caution to the wind, and I want to make that abundantly clear. It has been too devastating for us, and we are being very careful. We will continue to be careful, and we will continue to follow the guidance of our health department to facilitate a safe reopening. And to help our county move forward, I'm asking every resident that to please continue to do your part to stop the spread of COVID-19. Please follow social distancing guidelines. We want you to avoid unnecessary travel. Please continue to wash your hands. Do all the things that our public officials have advised us, the medical officials, to wear your mask. And when it's your turn, we ask you also please to take the opportunity to get vaccinated against COVID-19. We have made significant progress, and if we continue to work together, we can keep our friends and our families safe from COVID-19. I want to thank you all for joining us again this morning for these important updates. This has been a long ordeal for all of us. This has been such a trying year for all of us, but we're getting closer to defeating this pandemic every day, once and for all. And if we continue to work together and look out for one another, I am so confident that we will be able to safely continue moving forward over the coming months. And I want to just say again to our Prince Georgians, just once again, we are just so proud of how this community has come together. I want to thank you for your sacrifices that you have made. I want to thank you for the patience and for the diligence. I want to thank you for holding us accountable. We just appreciate all of your efforts. And I said to you when this started, and I will say it once again, COVID-19 will not have the final say. Our community absolutely will emerge from this, and we will do so in a way that leaves us better off. So we have additional updates, and we'll continue to provide those to you on a regular basis. But right now, I'd like to welcome Dr. Askew to the podium for his updates. Thank you.
Thank you, Madam County Executive, and good morning, everyone. I'm very excited about the county's vaccination progress. In fact, I'm going to take this off. Each day, thousands more Prince Georgians get protected from COVID-19, and that is getting us closer to putting this pandemic behind us. Thank you to those who have received their vaccinations when it was your turn to become proud to be protected. And thank you to those who are waiting patiently to get your shot or shots. We're going to get to you. Before we discuss vaccines in detail, let's start with an update on what's happening with the virus in the county. Cases are trending down slowly. Last week, the county reported just over 1,000 cases. 3 weeks ago, that number was 1,200. 2 weeks ago, it declined to 1,100. So it's our hope for next week that new cases will get below 1,000 and continue that trend. Our average daily case rate is hovering around 16 new cases per 100,000 population per day. This is still considered a high rate, but this is a big improvement from where we were just 2 months ago. On January 8th, our case rate was 58.8, nearly 4 times as high as it is right now. We are clearly not done yet, but this is great, great progress. The COVID positivity rate in the county has been below 5% for over 2 weeks. That's encouraging, and another sign that COVID spread is slowing down. Right now, the positivity rate is 4.3%. It has not budged from the 4% range in that 2-week span, but we're glad to see it staying below 5% consistently. The infection rate is still below 1, and that's also a good sign. As a reminder, the infection rate measures how many other people, on average, are infected by a person who has COVID-19. We are now at 0.94 infection rate, which means an infected person can infect fewer than one other person if they're positive, which means the spread is slowing down rather than speeding up. If we can get below 0.9 and stay there, we'll be in an even better place. I'm happy to report that the number of people who are in the hospital due to COVID-19 in the county keeps going down. Last Friday, there were fewer than 100 COVID hospitalizations for the first time in 4 months. At last check, there were 92 people in a hospital bed because of COVID-19 in the county. Our hospital capacity remains strong. 55% of hospital beds throughout the county are available to care for residents whether they have COVID or not. We've had more than 50% of hospital beds available countywide for almost 2 weeks. And right now, COVID-19 patients make up just 8% of our total hospital population. The progress in our key metrics, the reduction in our hospitalizations, and the thousands of Prince Georgians getting vaccinated each day allows us to move forward safely and cautiously with resuming our reopening journey. It is a journey that will continue to be prudent and data-driven. Prince Georgians have heeded our call to be safe and look out for each other time and time again. Yes, we are easing some restrictions, but we have to keep wearing masks over our nose and mouth in public. We have to keep staying at least 6 feet away from people we do not live with. And having get-togethers or parties with those we don't live with must be avoided. Washing our hands often is also still very important. So if we keep combining these safety precautions with accelerating vaccinations, we will continue this steady ride out of the pandemic. As the county executive mentioned, we are so pleased to say that the county has crossed over 100,000 Prince Georgians receiving at least one vaccination so far, one vaccine shot so far. The four clinics operated by the county and our mobile units have rapidly increased the county's health department's capacity and now can administer well over 15,000 doses a week with the commensurate supply of vaccine, of course. This week, we learned our health department went from 23rd in the state to number 3 in the state for first dose administration. 23rd to number 3 in first dose administration. And we did this in less than a month. In fact, it was in less than 4 weeks. We have also added 2 more clinics where those who live or work in the county can get vaccinated. One is at the Kitland Community Center in Landover, and another is at Cedar Heights Community Center in Seat Pleasant. As a reminder, as the county executive said, the Sports and Learning Complex Clinic will close temporarily, just temporarily, from this Saturday, March 13th, through Sunday, March 28th. No appointments will be scheduled there during that time. Some maintenance work on the building must be completed, but we plan to reopen the clinic on March 29th. The county and other vaccine partners are still focused on vaccinating certain essential workers as well as our senior citizens. As of today, approximately half of the seniors 75 years or older in the county have received at least 1 dose of vaccine. More than a third of our seniors 65 to 74 have received at least 1 dose of vaccine. Our partners have also played a huge role in expanding vaccine access throughout the county by expanding their capacity each week. When partners get doses from the state, we work with them to make sure county residents get an opportunity to be protected from COVID-19 with a vaccine. Currently, there are upwards of 158,000 residents who have signed up overall on the county's vaccine pre-registration list. Many of these folks are still waiting to be vaccinated, but tens of thousands have been removed and put into appointments and vaccinated. Demand and interest in receiving the vaccine among Prince Georgians is still much higher than supply. When one of our partners says it can fill appointments, we help them vaccinate residents from our waiting list. And so far, we have distributed, as the county executive said, approximately 65,000 names to our partners to contact them for an appointment. So, If you're contacted by a group other than the county to get vaccinated, don't be surprised. Take the call, take the email, sign up, get vaccinated. Luminous Health has opened vaccine clinics at Prince George's County Community College in Largo and Reed Temple AME Church in Glendale. Luminous and Kaiser Permanente continue to vaccinate school teachers and public and private school teachers and staff. And we're also providing pre-registered people to MedStar as well as vaccine in the University of Maryland Capital Region, who's also working diligently to expand their efforts, and I think they'll be making some important announcements very soon about their expanded efforts as well. And the ARC of Prince George's County has clearance from the state to operate a clinic for residents 65 and over. And speaking of the state, that partnership keeps expanding and strengthening. I want to thank the Hogan administration and the State Equity Task Force for their hard work and their partnership. Finally, I want to repeat my tremendous trust in the science behind each of the vaccines being offered. In rigorous clinical trials that cut no safety corners, the Johnson & Johnson, Moderna, and Pfizer vaccines showed they provide excellent protection to keep you healthy from COVID-19, and most importantly, alive if you still become infected with COVID-19. And most importantly, alive if you still become infected with COVID-19. The Prince George's County Health Department does not recommend one brand of vaccine over another. We only recommend that you take the first vaccine that is made available to you. And when you get the vaccine, don't be surprised if you feel a little achy or tired. You may get some nausea, you may get a little fever. These side effects are normal, and they will most likely go away within a day or so. We are making tremendous progress toward leaving COVID-19 behind and reclaiming our lives. I urge everyone to stick together and stay informed as we forge ahead to a healthier and happier Prince George's County. Thank you.
Okay, so with that, we will take any questions. Go ahead, Will.
There was a little bit of miscommunication going on with government representative. I was wondering, it seemed like you were able to get that straight in terms of what the county can do in reopening. And stop asking if you could, some of the statistics in regards to Johnson & Johnson, has that been inputted as of yet? Because I know some Johnson & Johnson were at some residents got it at Reed Temple.
So, we were able to get the guidance we needed. Our county attorney's office was able to talk with the attorney general's office, and we got the guidance we needed about the authority we had to make decisions that were different than the states, to be a little less, to be a little more restrictive in our reopening based on our experience here, the data that we were following. So if that's your question, yes, we were able to get the guidance we needed to be able to make the decisions that were necessary for Prince Georgians.
Yes, the Johnson & Johnson vaccine is in the county. It's being given out by not only by the county health department, by Luminous Doctors Community Health Center, also is giving out the vaccine. And what we're finding, much to my delight, is that people are extraordinarily excited to receive the vaccine. A one-dose vaccine, they don't have to come back. They're protected, and they're grateful for having it available. So that's what we're seeing, and that's what's really exciting. I was at Ebenezer Church last weekend, where we gave out 60 doses of Johnson & Johnson, and people were so grateful and so happy. And I was particularly happy to see so many seniors who made the effort to get out there. Our seniors are tremendous. They made the effort to get out there to receive the vaccine, and it was a delight to be there.
So, again, I'm accepting advice from doctors and scientists. And based on the reality that Prince George's County was the hardest hit jurisdiction in the region. We have to really be cautious. We saw that, for example, over the holidays, our numbers escalated so quickly. The improvements that we've seen, we know now from experience, can be reversed in no time. We have the holidays that are coming. We're still trying to get our residents vaccinated. And so we're being cautious because we don't want to see our numbers reverse and don't want to see us get back in the situation we've been in. So we are opening up, increasing capacity, and we'll continue to monitor these numbers. And as our infection rates and positivity rate decline, then we're able to make different decisions. But for now, I am accepting, as the leader of the county, advice from the health experts and the scientists who tell me when they believe it's safe to open. Well, the governor has different considerations than I do. He has to look at the entire state and make decisions for the entire state, and I have the pleasure of making decisions for Prince George's County. And we had the leeway we needed to make a decision here for my residents, and that's what we're doing.
Further along that line, your neighbor, county executive Mark Alfred, was quoted as saying that it's a serious mistake that the governor made an executive order, and also that he thinks this is going to trigger another spike before vaccine supply is
So we're making, again, we're not going as far as the state has gone. We don't believe that our county is ready to do that. Our information, health information, and information we're following regarding vaccination rates and such give us the guidance that I've received is that it is safer for us to go to 50% at this point. So we're not going as far as the state has gone, and we'll continue to monitor all of our numbers and make decisions there. But we at least appreciate that we're able to be different from the state if necessary. So I've signed an executive order implementing the amount of openings that we believe are safe for us.
And then a follow-up to that, into the information not going to the county executives before it was announced. Is that problematic for you as county leader?
Well, we always like to be in as much communication as possible, as much advance notice is helpful to us. We would like that. The truth of the matter is we were monitoring all of our metrics anyway, and I was expecting that we were going to make some opening decisions in the next week or so. And so this was, in line with what we were planning to make some opening, but not go quite as far as the state has gone. But we did expect, in looking at our positivity rates and infection rates and those things, that we would have the opportunity to increase capacity some. Oh, to 1C? Okay, let me have Doctor ask you to please talk about
Sure. As you know, we've been concentrating on our 1B, our 1A, and our 1A folks, but also asking all of our 1C folks to pre-register. We have begun to spread those names to some of our partners, so you will see folks in 1C being vaccinated by some of our partners. We're actually in the process of developing our final plan for moving forward into 1C. So I would just say, stay tuned. Sorry, I don't mean to tease, but I also don't mean to overpromise. But I would really say, stay tuned and very soon.
What's the metrics you see, sir, in terms of the numbers of when it would be safe for the county to expand and allow businesses to have more capacity?
We're going to do what we've continued to do all along, is we look at our metrics every day, but we really work on sort of a 2 to 3 week period and looking to see what the 2 to 3 week period reveals to us. And from there, we advise the county executive on where we think we can go from a clinical standpoint. And of course, the county executive has the overall final say. So we're always watching our metrics, and we reserve the right and the ability to make sure that we're responding to that data and what it shows us. So while there's a time frame that we like to see every a 2 week consistency, we still reserve the right to remain cautious based on what's happening out there. We still don't know exactly what's going to happen with all the variants. Fortunately, we haven't seen the kind of spread that has happened in other parts of the world. So we'll continue to watch that. We'll continue to watch our data, and we'll make smart and prudent decisions and recommendations to the county executive.
You happen to know how many the Johnson & Johnson vaccines have been distributed and administered in the county so far?
I can tell you that we received at the county health department 1,400 of the Johnson & Johnson, and we're getting those out. I don't know exactly how many of the Johnson & Johnson went to all of our partners, but I do know that many of our partners received the Johnson & Johnson vaccine.
Can you quickly talk about, I know we've had these discussions throughout the pandemic, but with the latest executive order issued in Texas, it specifically looks at hospitalizations. Can you talk about here in the county what the expect are going to be now that we're this far in with the variants and with the
With respect to hospitalizations, we're looking at hospital capacity. We'd love to see our hospital capacity above 60%. We're getting very close to that right now, so that we end up in sort of the next level of comfort with respect to hospitalizations. What's happened in other places, frankly, I would say you don't want to jump out of a plane and discard your parachute before you hit the ground, and we're not going to do that here in Prince George's County.
And then with regards to, like, say, the top few metrics you're looking at, all of the metrics.
Oh, sure. So again, as we talked about our infection rate, which is now at 0.94, our positivity rate, which we want to see below 5% consistently, and it has been, and it's now at 4.3%. We look at our cases per 100,000 per day, and right now that's at about 16 cases per 100,000 per day, and we want to see that below 10 at some point, but we're trending in the absolute right direction on those things.
Executive, on a different subject, I suspect you're not going to make any announcements here today, but I got to ask about the progress on police chief. All sorts of buzz in the community and within the department. Are you getting close to a decision?
We are. We're getting close. I can just tell you that. We're getting very close. But I can tell you that I regard this decision as one of the most important that we'll make. And we've been very careful and taking the time that's necessary to review all the candidates. But we're close. We're very close. I can tell you that. We're almost there.
All right, any further questions? Thanks so much, everyone.
Thank you all.